and welcome back. We're talking with Providence Hood River Memorial Hospital and their new Telestroke program. And it's obviously, if you saw this first segment, it's something that's really cutting edge. And Dr. Wilhelm, I wanted to ask you about the, well, first of all, I guess we should mention Providence was the first to implement this in the state of Oregon, and then the Hood River Hospital was the third.
That's right.
Actually, because it started on the coast with Providence, is that correct? And then there was a second hospital, now Hood River. So Providence is kind of leading the pack on this.
We hope so.
Yeah, well, that's great. So going back then to the whole mock that was done at the Hood River Hospital, let's just kind of walk through that and tell me a bit about how that whole event unfolded.
Sure. Well, Mr. Lugwood was brought to the emergency department by fellow officers, and I think we had a little bit of a warning that he was going to show up, which was always nice to know that's going to happen so we can assemble our team and be prepared for it happening. So it was rather dramatic. He was kind of carried in under the shoulders by his comrades, placed on a gurney, and within minutes we had people flocking to his side to start IVs, hook up a EKG, start monitoring the situation, assess his blood pressure. With a very quick review of what was going on with him, it became evident that this was a typical patient who was having stroke symptoms. And we instigated our stroke protocol. And a protocol is kind of a fancy way of saying we've developed a system for taking care of specific illnesses, whether it's heart attacks or strokes or trauma. It in essence kind of simplifies things and gets rid of some of the air making that would happen if you were just to approach these things on an individual basis. So by having a system to take care of something like a stroke, everyone knows their place in the system. So we have X-ray technicians who know that they're going to come at a certain point and take the patient off and get a CAT scan. We have lab techs that essentially know that they're going to get specific lab work. We have nurses that assign themselves to doing specific things like getting the EKG or getting the IV. It decreases the errors in what's going to happen. So in Mr. Lugwood's case, people knew what they were doing. We got his head scan, and then we brought in our robot, our Telestroke device, and within mere minutes of setting this up, we had a neurologist online in Portland. And I think what's the important message about having the neurologist online is this neurologist in the Providence system basically is taking care of strokes on a daily basis all over the stroke network. Okay. So not only are they taking care of strokes in Portland, but they're taking care of strokes in our rural areas. And because that's essentially what they do all the time, they're experts in what they do, and they're really able to help us focus in on key aspects of the examination. They're able to look at the CAT scan in real time, and it takes away a lot of the time element for treating the patient, because as I said earlier, time is brain. And in the past, if we'd have a patient who had a stroke, you would have to wait for a radiologist. You'd get your CAT scan, you'd have to wait for a radiologist to interpret the CAT scan for us and to help us decide, is this the sort of stroke that we can treat with this TPA chemical, or is this the sort of stroke that, for example, demonstrate the patient is having bleeding in their brain and we needed to get them somewhere immediately and not treat them with this chemical. And then besides the time element of waiting for a radiologist, and at nighttime we'd have to wait for a radiologist maybe from a distant city to interpret our CAT scans, which is another time delay. At times we would have to wait to find a neurologist. And so your 4.5 hour window of the onset of symptoms to the treatment can really evaporate very quickly.
Sure. On
just waiting on phones and waiting on consultations. And so to have this teleradiology device there, it's amazing that you plug it in, you turn it on, and in minutes there's someone there. It's like, wow,
yeah,
this is great. And so you've got someone who is not only a neurologist, but they're a specialist in treating stroke who's there to help you immediately.
Very cool, very cool. So you're basically taking, like the global resources essentially,
right?
And you're being able to bring that to a very local community,
right?
So awesome. Do you think this is going to also be translated into, say, burn victims or people who have possibly, some kind of terrible fracture or something like that, or possibly a head injury or something? Do you see that? This same technology being implemented in those areas?
Well, I think it will, because the unfortunate fact of living in a beautiful place like the Gorge is that it's rural.
Right.
And you cannot attract specialists in certain fields because there's just not the patient population to support them.
Okay.
And there's only one burn unit in the whole state of Oregon, and we'll see people who have burns. And although medicine is supposedly a great technical language to describe the extent and type of burn that someone has, it's really good for someone to be able to lay eyes on that patient in real time and help you make a determination. Should that person come to the burn unit now? Is it okay to delay it a few hours? The same with someone who's broken their hand on a Friday night. Specialist probably doesn't want to be up in the hospital doing surgery on someone's hands any more than you or I would on a Friday night. They want to be in their cozy bed. And so if they were able to look at this complicated hand fracture and decide, yeah, that needs to go to the OR right now, that's a good thing.
So you basically have a virtual specialist on staff.
That will be my hope, that we can expand it to those other fields.
That's exciting. Well, we're going to talk a little bit about actually some of the symptoms of strokes with Nurse Jane Burke in the next segment. So I want to thank you very much, Dr. Wilhelm, for coming on. It's been a pleasure to learn about this. This is really exciting stuff, and I'm so excited that we have it right here in the Columbia Gorge.
Thank you for having me.
Absolutely. Appreciate your time. Okay, you guys, we'll be right back here on Localite.